Well, this is my now third take trying to start this video for you, and I honestly had no idea it was going to be so hard for me. I knew that this is an emotional and challenging part of my journey, but until I pressed play or I pressed record, I actually didn't think that the emotions would come out like they are. With that being said, the whole purpose of this video today is to share a little bit of my journey with you, but more I'd like to share what I learned throughout the process, so that if you are newly embarking on your journey and the situation that I'm in resonates with you, I hope that you can take this information and perhaps doing a little bit more investigating for yourself to see if the options that I chose would be a good fit for you and your future. So as you probably saw in the title, the focus today is fertility and chemotherapy. So I was diagnosed when I was 33 years old, and I think I'm in a bit of a special situation in that my husband and I didn't have kids yet, and we wanted them still. And I certainly know that I am not the only one in this position. So there are some special circumstances that we're having to deal with now. My husband and I found each other when I was 29. I had almost given up on the idea of finding my match, and I was okay with that. But this man swaggered into my life and completely filled the missing piece for me. And we wanted to enjoy all the steps of our lives together. So we took 3 years to date, to get engaged, and then to get married when I was 33 years old. So I guess 4 years. And we knew that we wanted a family, but we wanted to enjoy a little bit of that newlywed time together as well. So about 5 months after we got married, we decided that it was time. We were excited to embark on the next adventure together and aim to start to have a family. About this time, I had found a lump in my breast, just doing a really informal, I can't even call it an exam, but I was just kind of feeling and getting to know my breast, and I found something. If you haven't watched my video talking about how I found the breast cancer and 4 signs that I've missed, I would recommend checking that out later, because I'm not going to get into that today. So let's fast forward to the day that we found out. My husband and I were sitting in the doctor's office with a doctor that was not actually mine at the time, and we received the diagnosis that I had breast cancer. I cannot even explain how earth-shattering that was for us. I was, in my mind, the healthiest I had ever been, looked after my body. So just as we were trying to take all that in, the fact that my life was now threatened with cancer, we asked the question, are we able to still try to have kids? The answer was no. As you can imagine, that was insult to injury, we were told that we had to put that goal, that vision of our life together on hold for a number of years. However, we were told that there are some things that we could possibly do to help protect and preserve our fertility for after I was done and through active treatment. So of course, that is something that we wanted to do and we wanted to look into further. We are very lucky to get into the fertility clinic in our area. The closest one to our small town of Salmonarm is in Kelowna, which is about 2 hours away from where I live. Doctor-wise, and the ladies at the clinic there were unbelievable. Upon meeting Dr. Wise, something that I learned, on top of the fact that we would have to wait, is that chemotherapy treatment can cause infertility in women. The medications in chemotherapy can be so strong that they put the female body into a state of menopause, and even after the chemotherapy is done, sometimes it doesn't come out. Now that we not only have to put our family planning on hold, we learned that it could be taken away from us in the sense, in the version that we had envisioned that would be an option for us in the future. I asked her why, what causes this to happen, because I'm someone that likes to know why things happen. So she explained in more technical terms than this. This is what I heard. She explained that the chemotherapy medication attack quickly dividing cells, which are cancer cells. However, there are other cells in the body, such as hair follicle cells and cells within the reproductive system, that are also rapidly dividing. Therefore, the chemotherapy medication just attacks all of those cells with the idea of getting rid of the cancer, which is why sometimes hair falls out during cancer treatment. And that is also why sometimes the reproductive system can be damaged too far to the fact that it does not return. Of course, this makes sense, but of course, this is also absolutely devastating. So she said, try not to worry. I do have a couple of options that I can provide you. She told me that there are certain chemotherapy medications that are harder on the reproductive system than others. One of the two medications that I was getting just so happened to be one of those extra harsh medications on the reproductive system. However, she did say that there is some good news, and I am so excited to pass that good news on to you. This is the part of the video that I'm really excited to share with you, because it is the part that for us gave us so much hope that we would be able to conceive in the future, and if we weren't, that we would have options. Before I get into it, I do want to say that these two options I'm going to share with you, I'm just going to give a really quick summary today and go more into depth into each of them later. So the first one she offered us was IVF, or in vitro fertilization. And the idea for this for us was to basically act as if Sam and I were trying to start a family right at that time with Dr. Wise. So we had the consult, we had the blood testing, I had the blood testing, the ultrasounds, I had the ovarian stimulation from the daily shots, I had the trigger shot, and we were sent to Vancouver, which is about 5 hours away from where we live, for the egg extraction and then fertilization with Sam's sperm. So the whole idea there is to really have that process already done. My eggs are young, they're healthy, Sam's sperm is young, it's healthy, and then they are frozen for down the road if we need them. So this is an option that we took up. The thing that she did let me know was that it's typically a very successful procedure. However, she has seen in some cases, such as mine, where the woman is under extreme stress, where she isn't able to produce as many eggs as perhaps a younger or less stressed person can. But she said overall, it's a pretty reliable, successful process, and she had very high hopes for us. The other thing to keep in mind with IVF was that she recommended that it be done before chemotherapy. So for me, chemotherapy was going to be the very first cancer treatment I had. So I had to undergo the IVF process before I was able to start the chemotherapy treatment, which is something to keep in mind. However, we did decide to do that, and I am so very thankful that we did. The second option she was able to offer is what I'm referring to as fertility protection. So this is a medication that I was given just before, about a month before I started my chemotherapy, and I continued it for a month after my chemotherapy. So the idea with this medication, as she explained it, is that it puts the ovaries into a sleep state with the medication that causes ovarian suppression. So in my mind, this is how I'm interpreting what she said. When she was explaining that the chemotherapy attacks quickly multiplying cells, which are cells that are found in the ovaries, by suppressing the ovaries or putting the ovaries to sleep, it isn't as much of a target for the chemotherapy drugs because they're not those quick moving cells, if that makes sense. So the idea here is to keep the chemotherapy away from the ovaries by simulating that they are not active. So this medication needed to be administered by a nurse, and it was administered for me every 4 weeks, and I usually got it in my glute muscle. Once again, I'll share a little bit more about this, the side effects I experienced from it. But as I've already mentioned, I did decide to do this as well. And once again, I am very thankful for this option and thankful that I decided to choose both the preservation and protection of my ovaries and fertility. I'm happy to share this because knowing that there were options to protect and preserve my fertility meant so much to me. I can't tell you for sure if it has worked. My husband and I don't have kids at this time, but just knowing that at the time I did everything I could to allow us that option for the future gives me a little bit of gives my heart a little bit of peace. I know that I did everything that I could, and the rest is up in the air. So, sending lots of love to you, my friend. There is hope, and if these are processes or if these are treatments that you're looking into and you want to know a little bit more about them, hit subscribe, as I will be sharing more about those and other things in the future. Take care of yourself, friends. We'll see you next time. If you have any questions, feel free to put them in the comments section. I would love to help in any way that I can. As I said, this is a very sensitive area for me, and if I can help you in some way, I would love to do that.